Good afternoon. Hello and namaste to everyone. And welcome to a session on uh, low AMH and how to go ahead. I'm so sorry. Welcome to a session on newborn care. Now, we are pleased to have Dr. Avash Pani, and who is with us, who is a MBBS and MD in pediatrics among us, who will educate us on this topic. He is a pediatrician and a pediatric intensivist, and he is going to enlighten us on the topic at hand. And we are pleased to have him as a guest. Sir, you may go ahead.
Hello, good afternoon, everyone. I'm Dr. Avas. Thanks for the introduction. I'm pediatrician at Apollo Cradle, Kondapur, in Hyderabad. And today we are going to discuss the topic of newborn care, and I have included infant care also till roughly 9 months to 1 year of age. Also, I'll be covering little bit. This topic is very vast, and many times the parents, new parents, are a bit unprepared for handling the baby. Although it is not so difficult, and with little preparation they can do it easily. But many times they are overwhelmed by the baby and all the demands that the baby has. So I'll try to simplify and make the parents more confident in handling newborn babies and up to 1 year of age also. So essential newborn care. What is the minimum things that the newborn needs for successful survival and growth and mental and physical both development? So essential newborn care is not very difficult. It is to be provided by the traditionally the mother, and of course the other family members have to contribute nowadays. That is the way. Father definitely, and other members also should contribute. And it doesn't require too much expertise also. Most babies are normal, and they don't have any disease or anything, and they don't require any doctor's help or any other specialized medicines or any things. So all the babies can be taken care at home unless they have some illness, of course, that we are not covering here. We are talking about normal babies. So babies should be kept with the parents, not in a separate nursery. So for rooming in, that is called, baby will be feeling the warmth of the mother, and emotional bondage will be more, and establishment of feeds will be easier and faster. So baby basically needs warmth, feeds, and needs to be cleaned, and needs protection and emotional support. And with this much only, baby can be successfully reared without any problems. So how to keep the baby warm? Initially, baby has to be dried immediately after birth. Later on, the bath and all should be minimized. Cleaning should be minimized, and keeping the baby dry mostly will be, that is the most important way to keep the baby warm. And then there should be adequate clothing. If it is winter, definitely thicker clothes are required. If it is summer or you are in a tropical country like ours, no need to wrap the baby too much. That is counterproductive and may cause the baby to become dehydrated and develop fever and high temperature. So adequate clothing, and the room temperature should be. Now people are asking what we are using AC. Can we use, and how much should the temperature? So AC can be used intermittently, not 24 hours. Mainly, maybe little bit during the peak summer season, and temperature can be kept at around 29 to 30 degrees. If it is a South Indian or any hot place, of course, if it is cooler place, then definitely AC is not required. And baby should be in skin to skin contact with the mother whenever possible, during feed definitely, and other times also. And the bath should be like initially sponge bath till the baby's umbilical cord has fallen off and the base of the cord has dried. Till that time, sponge bath should be given. And later on, there can be full bath with means shampoo, soap, all those things gradually can be added definitely. But the thing is, we have to make the time of the bath little limited so that the baby is not exposed to the water for a long time, and use little warm water depending on the situation, so that the baby doesn't catch a cold. Next will be the feeding. Next, most important thing is the breastfeeding of the baby till 6 months of age. So feeding should start once the baby has recovered, the mother has recovered from the delivery process as soon as possible. And the initial 1 or 2 days, the milk is called colostrum. That is very less in quantity, but it is very nutritive and has a lot of immunoglobulins, which help in the increasing the immunity of the baby. So that is very beneficial. It should not be denied to the baby on some cultural grounds. Some people don't give. That is not advisable. And the techniques of breastfeeding is important. How to hold the baby, how to position the baby, All those things need to be taught to the mother. That can be done by experienced family member, or if the hospital delivery is there, then almost all hospitals they can provide the knowledge and practice to the mother, wherein she can feed the baby properly. And demand feeding is encouraged. Like demand feed means some opposite of demand feed is scheduled feed. Every 3 hours you force the baby to feed. So it is not like that. Better is demand feed. So every 2.5 or 2 hours also, if baby is feeling hungry and demanding food, milk, feeding should be done. There is a time when the baby is after feed, suppose is sleeping. So after 1.5 to 2.5 hours, baby has woken up and is looking around, very alert, trying to smack his lips. That is the perfect time for feeding. After that, if you allow the baby to get irritable and start crying loudly, then baby may or may not feed properly. So before the crying starts, where the baby is very alert and woken up, that is the time for best time for feeding. That is the way demand feeding is to be done. Whenever baby wants, demand feeding should be done. And in between, suppose 5 minutes has gone, baby, this is a very common complaint. Baby has fed for only 5 minutes, again he has gone to sleep. So there you can stimulate the baby little bit by the soles or the back can be stimulated to wake the baby back and then continue feeds. So feeding pattern is completely individualized and cannot be really forced. So if some baby is taking less feeds more number of times, we really can't do anything about it. We have to do it like that. And exclusive breastfeeding should be done for till 6 months of age. Many places there are many cultural things which interfere with all these things. They give some honey water and all before the breastfeeding started, and many there are 100 things which people do which are not to be encouraged. So family members should be made aware. Here one more thing is the mother's diet also. So what many places there is some restriction on what the mother can eat or not eat, wherein the mother is sometimes deprived of nutrition and even hydration. Then the breast milk quantity and quality might get affected. So mother should eat a healthy, balanced diet, and there is no restriction on the mother's diet. Normal diet mother can eat easily, nothing will happen to baby. Next comes the umbilical cord care. So umbilical cord, there's a clip that the delivery during the delivery it is attached to the umbilical cord to prevent bleeding. So then that cord will slowly become dry and fall off at the age of around 5 to 7 days. Sometimes 8 9 days in case of rainy season, depending on the weather, it takes more time. Once the cord falls off, then there is the base of the cord is like it's like a wound. So slowly in 2 3 days it will get dried, and then finally it is completely dried off. Then we can give full bath to the baby. Till that time, the cord should be kept open and dry, so that the drying of the cord is fast. And of course, we should not allow any dirt or anything to fall on the cord, but we should not apply anything also. Like many people will apply neosporin powder or some betadine or some any 100 things people apply on the cord, which is very dangerous. That itself can cause the infection if you are applying some haldi or any other thing. So nothing is required. Modern practices to let the cord dry and fall off on its own, and no need to apply anything. If there is redness in the cord, then you have to bring to doctor if there is infection. Otherwise, don't apply anything. Spirit, many people will apply spirit, which is not required. And slight bleeding of cord is very normal. After the cord falls off, there can be slight bleeding. Few drops of blood may come, which nothing needs to be done. Just you can clean with a sterile gauze, or even not doing anything is also okay. No antiseptic powder or lotion or borolene or anything should not be applied. And then how to take care of the bathing process and skin care of the baby. So initially sponge bath is better till the baby is little bigger, and once the 15 days like that 10 to 15 days is over, then you can go for full bath. By the time cord would have fallen off also, and there's no risk of making the cord wet. And take care to avoid low temperatures, like cold water should not be used. Definitely warm water is ideal, unless it is very hot and tap water itself is warm, then you can go for direct tap water. Oil massage can be given before the bath. Many cultures they're very much particular on oil massage, so that should be given before bath, not after. So after bath, where means we should give the moisturizer that will keep the baby skin, prevent the baby skin from getting dried and flaky, and also prevents bacteria from entering the skin through the dried cracks in the skin. And exposure to sunlight in the morning is beneficial. That will increase the vitamin D in the baby. That is good one, and keep the baby a little warm also. Baby soap and shampoo can be used. Many brands are available. So any good brand can be used, and shampoo can be done twice a week or something like that. And soap, bath with soap maybe daily or alternate also is fine. And there is sometimes there's a condition called cradle cap where the baby develops a lot of dandruff. So there, what to do? You have to first massage the scalp with the oil first, then slight combing has to be done to make the flakes loose, and then shampoo should be used. Then slowly that thing will go. That is not a dangerous thing. It goes in 10 to 15 days time. Next will be eye care. So sometimes babies' eyes are watery from birth. So that is due to the blockage of the canal that connects the eye to the nose. The tears flow from the eye and go to the nose. So that sometimes is blocked. That in there you have to do massage. Both the sides massage has to be done like this. Maybe 4 5 times a day. Each time 5 to 10 times massage has to be done. And eyes should be cleaned with wet cotton swabs. Separate cotton should be used for each eye, and application of kajal to the eye is to be discouraged. Sometimes that kajal can become infected and cause eye infections. If due to superstition kajal is required, it can be applied somewhere where there is no problem, like the forehead or anywhere else, but not the eyes directly. That is to be discouraged. Even if it is homemade kajal, self prepared, it can still get infected and cause trouble. And next is the clothing. What clothes the baby should wear? In our country, normal cotton clothes, loose fitting, and soft cotton clothes can be used. And any type of nylon or plastic or synthetics to be avoided because it can cause various problems like allergies and sweating. The sweat can accumulate and cause the maceration of the skin. All those things. So the synthetic clothes should be avoided, and an absorbent cloth can be used as a napkin for the urine and all. It will be beneficial to use the absorbent cloth, and of course diapers can be used, but 24 hours diapers should not be used. So diaper use can be limited a little bit, especially during daytime. If people are around, the baby should be without diapers. And during winter, warm clothes can be used depending on the outside temperature. And there's one practice called swaddling, where the baby's hands and feet are tightly round, wrapped up in some cloth. So that means what they believe is that it can increase the strength of the baby, but scientifically it is not found to be correct. And better to avoid this practice of swaddling tightly. And baby to be roomed in with the mother, like not to be kept in separate room, and better to keep with mother and mother's room only. And baby should be handled gently with clean hands, and the baby should sleep with most of the time on its back so that the nose and face are exposed to the up or maybe to the side. Face sleeping on the tummy is to be minimized, especially it should be allowed only where the baby is means due for its feed, not on full stomach. Like already 1 hour, 2 hours have gone, and feed is coming. That time baby can be allowed on the tummy and supervised. So at that time, people should be one person at least should be looking at the baby and seeing that the suffocation is not there. So tummy time is important, but has to be supervised. And general hygiene, of course, has to be maintained. All the clothes and everything, beddings, everything should be washed from time to time and exposed to sun. And wet nappies should be changed regularly and should not be allowed to stay for longer periods. And then there is a weight of the baby needs to be monitored, especially babies on the lower side of the birth weight. 2.5 is the minimum, 2.5 kg is the minimum weight of the baby. Below that, it is called low birth weight. So weight will decrease after birth. So whatever birth, suppose 3 kg child is there. First 7 days, it might go down to 2.8, 2.7 kg also. Then slowly it regains till 7 to 10 days of life. The birth weight, the weight increases and baby regains by 7 to 10 days of life. And after that 20 to 30 gram per day roughly, but we don't need to check daily. So maybe roughly every visit will be there. So for vaccines, they will be anyway visiting doctor. That time the weight can be checked and recorded and tracked how the percentile is okay or not okay up to the mark. And roughly by 5 months, baby's birth weight is doubled. That way we can, and tripled by 9 months, of course. So all these things can be tracked by the baby, by the parents. And how to follow up after the birth, all these things we have done at home. So regular immunizations are required. So in India we have 1.5 months, 2.5 months, and 3.5 months. These are the primary three series of immunizations. So that has to be given. And there is a concept of mandatory and optional vaccines. Mandatory are the ones which government is giving free of cost. Nowadays, government has expanded its mandatory program also, and almost all vaccines in first 6 months of life government is covering. So all these vaccines has to be given. At that time, growth and development can be also tracked, and the education of the parents and family members regarding feeding, how to keep the baby warm, maintaining of hygiene, and rooming in, and how to wear the clothes, cleaning, etc., has to be reinforced during these visits by the doctor and whoever is coming in contact with the parents, maybe Anganwadi worker also. And then there are quite a few harmful cultural practices which needs to be curbed. They vary from region to region, but there are definitely some which are harmful. Some are harmless, which may be allowed. But the branding, suppose they take a hot rod and they put the branding on the baby's tummy, all those things definitely are to be discouraged. I think in modern times they're coming down slowly. So that's the thing. So, what is the importance of breastfeeding? So, in addition to a lot of nutrition value, which is better than the formula feed or any other feed, there is a lot of immunoglobulins and other immunity boosting agents in the breast milk also. So, these are the nutrition and immunity and all those things. Plus, there's the emotional component also. Breastfeeding helps in improving the emotional quotient of the baby, I can say. And there's a good bonding with the mother, and even the warmth also the body temperature also maintained better if the breastfeeding is done because of skin to skin contact. And next thing is, if by any chance breastfeeding cannot be done due to various reasons, suppose, then the next best thing is spoon feeding by Paladay, or some bottles are having little one spoon attached to it also. So avoiding the nipple feeding from bottle is better, because once you start the bottle feed directly, then the baby will not be able to. Usually they will not like to go back to mother's feed again. So that's why we don't prefer the silicone nipple attached to bottle for feeding of baby. And after each feed, baby has to be bobbed. It has to be made either sitting like this or putting on the shoulder and giving the burp, so that the air what has been swallowed during the uh, feeding that comes out. And this should go on till 6 months of age. After that, after 6 months of age, we have to add complementary feeding. Usually by 5.5 to 6 months, we start with dal water, then slowly add some rice to it and mash it and give. Then slowly graduate to khichdi and like sambar rice or dal chawal, like that. Whatever feed, chapati also can be added with milk, what soaked in milk, like that. So whatever ugu can be added, oats can be there. So variety of foods has to be added starting from 6 months of age till 10 months, 11 months. Every feed should be given to baby. Baby should be on everything by the time of 11, 12 months of age. Initially, there should be less salt and less sugar, plus masala, oil, all those things should be less. Then slowly by 9, 10 months, these things can be slowly introduced, and normal food can be given by the 10 to 12 months of age. Initial quantity will be like this much, 2 spoons, suppose, 2 times a day, suppose at 6 months. Slowly, slowly by 7 months and or 8 months, this can be this much 3 times a day. One fourth katori, 3 to 4 times also by the end of 8 months. Then slowly the quantity has to be increased, and by the end of 10 million months, full katori can be given. So this katori, what I mean, full katori is a meal. Meal consists of cereals, pulses, vegetables. So these are the things. If somebody wants to give non-veg also in pulses, the protein part non-veg can be given, not a problem. Yeah, usually people start with eggs and all. Later on, fish and meat pieces can be added once the child is bigger. So this is the main basis of the meals. Apart from that, snacks can be given, like fruits. Usually people will give banana and apple is the usual fruit that is started, that can be easily digested by the baby. Slowly, slowly, as I told, by the 1 year of age, baby should be taking everything. The wrong practice here, what I find very, very difficult to manage later on, if this grinding, the people will put all the rice, dal, khichdi, whatever they're cooking, into a mixer grinder and put it like, they mash it completely, make it like a liquid, and then they feed the baby, saying the baby cannot swallow, baby doesn't have teeth, baby doesn't have digestion. All these excuses are given. Nature has given so many things to us. Doubting that, people will go for all this practice. So initially nothing happens. It's all fine till baby is 1 year of age, 1 year to 12, 13 months of age suppose. Then you are starting to introduce normal rice dal. Then the baby cannot recognize it and he will refuse completely eating normal food because taste of normal daily food is not that great compared to biryani and other manufactured food. So at that time, some neighbor or guest or relative will start give offer baby some of these foods also. So we will find it very tempting and tasty and go for that biryani kind of food. You understand? So then the parents will say at 2 years, suppose baby is not eating anything. Then I'll say, how I fed the child from 6 months to 15 months of age? Have you used grinder? Invariably the answer will come yes. So this practice has to be stopped and normal hand mashed initially semi-liquid of course. Slowly it has to be normal texture by the age 9, 10 months of age. That has to be taken care. This very common thing I am finding nowadays. And feeding in babies is roughly 3 hourly. Slowly, as the baby is bigger, it can be 4 or 5 hourly also. Slowly, number of meals will come down, and number of times the milk is being given also will come down. So, by the after 1 year of age, hardly baby should take around 400 to 500 ml of milk per day maximum. More than that, milk should not be given because it doesn't really have all the nutrients that we need as a bigger child. For a small baby, milk is sufficient, but for bigger children, they need many other nutritive factors which are not there in milk. Uh, so slowly, milk should be decreased, and after 1 year of age, usually there will be four meals and one or two snacks and one milk, maybe two times maximum, morning and evening or something like that. That should be the schedule of feeding till 1 year of age. So if we give variety of foods, we can give key nutrients and give a balanced diet to the child. Along with that, once we start the outside food, we have to start water also. Till 6 months, water is not required. The milk is sufficient because milk has almost full water only. No need of extra water to the baby till 6 months of age. Once we start outside food, definitely we have to add water and adequate water has to be given later on when the milk is less so that baby doesn't develop. Usually they develop constipation if they don't get more water. It's a very common complaint at around 8 9 months of age. So at that stage, adding lot of fruits and adding water will help in easing the constipation. Of course, we have other way also nowadays. Lot of overweight babies also we are seeing. So overfeeding has to be avoided. Do not force feed the baby. At 9, after 10 11 months, self feeding is to be encouraged. Once the baby is eating on their own, they will eat as much as required by them. So if we start running after them with spoon, they will get aversion to the food and they will not eat normal. Then again grinder and then running after baby and trying to stuff their mouth with food. Those two are going to make the baby averse to normal food. So avoid overfeeding, avoid force feeding, encourage finger foods with self feeding with spoon after 1 year of age. Watch for any food allergies. If you find anything any allergies, then better to avoid that food. So then again at 7 months of age, teething will start. 7 to 8 months, teething starts. The baby will get very fussy at that time and try to bite each and everything, especially hard objects, so that they get soothing effect here. So in that time, we can give teethers to the baby. There are some toys like which are called teethers. They can be given, and at that time, many times they'll get loose motions because of not because of the teeth coming out, but at that age they start crawling and putting everything in mouth. So that's why hygiene maintenance definitely comes down, which is okay. We don't have to really strictly make it a sterile environment for the baby. So that little infection may cause little bit motion and fever. That nothing to get worried about. There is no medicine as such required for that unless it is severe. And teeth brushing should start definitely at the age of 7 8 months when the teeth one or two teeth are there. From that time onwards, brushing should start. Initially, it can be with a finger brush, silicone finger brush, but later on when there are more teeth, you can use a smaller baby brush along with a baby toothpaste and take a smear of the toothpaste and give the brushing. Okay, so anything? So once the baby is there in the house, maybe till 4 5 months, it's okay. After that, the safety is very important. The house should be made child proof. So many things has to be done to ensure that baby doesn't uh, baby is not in a dangerous situation. Especially choking is a very important thing that has to be avoided. Choking is small, this size object getting stuck in the windpipe. or going into the lungs. That is life threatening, and baby needs immediate expert care to remove the objects. Otherwise, it is life threatening, no doubt. So sudden breathlessness, or maybe the parent might have seen that baby is eating something, then baby chokes and coughs and becomes breathless, maybe blue also. So that small objects should be avoided in the house, like end of the pen will have small cap in the end. So like that, small crayons, erasers, parts of toys, the wheels, etc. All those things are very very dangerous. Then the other section is the small grains, like pappu we call here. That in the kitchen also they can put that might go into nose or mouth and get stuck. Those things should be totally out of reach of baby to avoid choking. Then there is suffocation. Nowadays, a lot of packaging is coming into house because of orders from online, and previously also a lot of polythene bags were available in the house. Those things are very much dangerous. Crawling baby finds one, he might put it on his head and choking might happen. So these things has to be avoided. And third thing is falls. So small baby also can fall even if it doesn't know how to turn, because they lift the leg and then by gravity it will fall down. So they should not be left alone on the bed and any raised area, and definitely should be once the child is 4 5 months old, they can be left in the ground so that the development is faster also. If they are leaving the child totally on the bed where the mattress is very thick, then the force of the baby while he's pushing down, he will not feel it. So raising from the ground, turning around, sitting, everything will get delayed if baby is not allowed to sit on the ground with a small thin chatai we call it. So that is very important. Then poisoning. Everything, any chemical in the house is a potential poison. So if and medicines also. If people are taking, if elderly people are there, diabetes medicine, hypertension medicine, or any thyroid medicine, all medicine should be kept in a lock and key and out of reach of the child. So child should not be allowed to have access to any medicine at any cost. Other things are the bathroom chemicals like harpic, phenyl, etc. Kerosene used to be there. We have seen a lot of kerosene poisonings. Then mosquito oil, that liquid is there, electric thing which we put in the wall. That also we have seen many times. Babies somehow open the cap and they drink it, and poisoning is there. And next is the kitchen, where a lot of like cooking oil and other things are there, which needs to be totally prevented from baby's access. We might have to keep the kitchen door locked also. Sometimes the baby is very hyperactive. And then burns and exposure to sun. And if there are pets or pets or stray animals in neighborhood, that also needs to be. But baby needs protection from these animals also. Sometimes the clothing also is very important. Some baby clothes will have a hood or some string here. At the end of the string, there will be plastic covering the knot, and over that there will be a cap. So that is very very then easily it is directly on the mouth. That can go easily into the windpipe, causing a choking hazard. Sometimes the string or any loose clothes can cause a strangulation on baby. These things also has to be taken care very carefully. So, in brief, this was very briefly about newborn care and infant care till 1 year of age. Although this topic is very vast, hopefully, with this much. And also, parents are encouraged to read infant care books are available. So, better to read it during pregnancy time only, so that what is normal, what is abnormal, they can differentiate and not get too much worried about. Like suppose example, baby has not passed stool since 3 days, they'll come in anxiety. But that is not correct. Baby will most what you have to see is that baby is active, is warm, feeding nicely, and passing urine nicely. These are the important things. Not passing stool since 3 days or passing this small amount 10 times a day. Small example I'm giving. These are all normal things. Hiccups is coming, and then there's a light red rash all over the skin. That is also normal. Like that, normal things also parents can educate themselves, or when they visit the doctor first time they can ask and get it cleared so that they don't get unusually alarmed over normal things. So hopefully this is helpful for everyone. Thanks a lot. Thank you. We'll stop here.